Hello, listeners. A warm welcome to Views on Health. A great pleasure to have with me back on the program after a short break, Dr. Pravin Wijesinghe, consultant plastic surgeon at the teaching hospital in Batticaloa. Welcome to Colombo, to SLBC, and of course the program, Doctor.
Thank you, Fatima, and a warm welcome to the listenership.
Well, listeners, for your information, the topic under discussion today will be brachial plexus injury. Sounds technical, sounds complicated. Perhaps the injury per se could be complicated or otherwise. Without any further ado, may I invite the expert, Dr. Pravin Wijesinghe, to introduce the topic brachial plexus injury. Over to you, Doctor.
A brachial plexus injury is basically a paralytic injury to the upper limb. It's a common but a devastating injury to whoever gets it. If you go to the technicalities, a brachial plexus is the plexus of nerves, which are just 5 in number, but they form a network that supply the upper limb in anyone. These nerves can get damaged, generally at the level of the neck, during certain events. So if you look at it broadly, it can happen in a newborn child during birth trauma. It can happen during a normal vaginal delivery or a cesarean section. But more commonly in the adult, it can happen most commonly due to road traffic accidents. So I thought I'll talk about this. It's not a common topic to talk about, but I thought I'll inform the listenership about it, because I'm sure you'll find someone somewhere out there that will need help. And the early referral or early treatment is the key to success. If I go through the anatomy of what goes on, so there are 5 nerves that supply the arm or the upper limb, and these nerves start from the spinal cord, goes down to the tip of your finger, generally doing 3 functions. It brings about sensation. So the sensory nerves supply the whole upper limb, the skin, and it takes vibration, pain, temperature, touch from the periphery to your brain, so you feel it. There's also the motor function. You lift your arm up, you flex your elbow, you flex your wrist and extend your wrist. You do everything with your fingers. Plus there is a temperature regulation and a sweat regulation function, which is the autonomic function. So when you have an injury to the plexus, you can get disruption of all these functions. And this injury could be a tear or complete disruption of that nerve. Either it might be a single nerve, it can be all 5 nerves. Or it could be just a stretch of these nerves. And these nerves generally, if it's just a stretch, it just recovers over time. But they do present with a significant disability. I'd like to talk about the causes of this. So as I said, it can happen in the newborn baby. In the newborn baby, it's generally due to the process of birth, where if it gets prolonged, the angle between the neck and the shoulder gets wider, and they get pushed through, and this can stretch or tear the nerves that are coming to the arm. It can also happen in the adults, which is the more common one that we see. In kids, it's about this is not Sri Lankan data, this is world data, 0.4 to 4 per 1,000 live births. But more commonly in adults, it's about 5% of all road traffic accidents, especially the motorcyclists. They are the ones that go flying over the handlebars, land on their side, which stretches the nerves. But they can also occur from penetrating trauma. It can occur from a stab injury to the neck or a gunshot injury to the neck. So with regards to the presentation, in adults, they come and tell you, "Doctor, I was fine before the accident, and now I can't move my shoulder. I can't bend my elbow. I can't move my fingers." They also come and say, "Look, I can't feel anything in my limb." In a child, it's trickier, because they are never going to come and tell you. You need to sort of assess. And something that the parents come and tell us, the other limb is moved well, but this one doesn't move as much, Or if the both limbs are involved, they come and say, you look, my first child was moving fine when he was born, but this child is not moving as well. They also go into a specific posture of the upper limb. They show a typical posturing of the upper limb when it happens. And that might be the first hint as to the fact that the child is having an issue. So what do? As soon as they come, you need to refer them early. I mean, that's really, really important.
That's a good point, doctor, that you need to refer them early, because in any ailment, as they say, precaution is better than cure, and then one tends to procrastinate, so to speak. I mean, as adults, we can be a bit lethargic before we sit up and take notice and think, now we have a problem and we need to seek medical attention. I just want to go back to the babies for a moment. Now, as soon as the baby is born, and if this issue is there, would one know, meaning a pediatrician or any other doctor who just sees the baby, of course, apart from the gynecologist, so all of them put together, I mean, would one of them notice that there is an issue with the baby, because baby obviously can't say anything? And another question, Dr. Ryder, to that, is it a painful condition? Because an adult can say it's hurting, or even a child who can speak, but a baby can't. Then does the baby keep crying as a result to draw attention?
With regards to the baby, this is in the babies, it's called a obstetric brachial plexus injury, and generally, if it's just a stretch of the nerve, there is no pain. They just don't move. And they can move the hand sometimes, but not the shoulder, and the shoulder becomes internally rotated. They keep it in a very typical posture. These, depending on the trauma they go through during the birthing process, they can have fractures of the upper limb, the arm, the humerus, which is the arm bone, or the clavicle. Now, if that's the scenario, that those babies will present with pain every time you move, and those are actually very difficult to diagnose. The first diagnostic clinician is going to be the first pediatrician, who is going to be a neonatologist that's going to assess the baby as soon as they're born. The problem there is sometimes they think that this could be just a fleeting thing, and generally it could be. It could be something that lasts for a month, but after a month they completely recover spontaneously. So they do procrastinate again. They do delay the referral. What we say is, as soon as you think there's an issue, and this is for all the pediatricians out there too, if you think there's an issue, do refer, because we will assess, we will reassess in a month. And if we need, some of these are time sensitive conditions at times. So if it is a time-sensitive problem, these surgeries that we do may need to be done early rather than later, because there is a time slot where we can do for the best results. If we go beyond that, the results are much, much poorer.
And then getting back to the accidents that you spoke of, from statistics that we have, the motorcyclists are more prone to accident injuries, road traffic accident injuries, as against any other road user. And also we here in Sri Lanka see them being very reckless, and they just whiz past, or they zigzag their way through traffic. Patience is not in their book, but in traffic they obviously can't do much damage to themselves. But when the road is free, and then they are really riding fast, and then they come across another person that they avoid trying to hit, or they hit, or another vehicle, they collide, then the problem sets in. So similarly, doctor, from the number of motorcycle riders who are leading in terms of statistics in the injury capacity, what would you said that the same thing is applicable where this brachial plexus injury is concerned with them. So part of the injury is related to this problem?
Yeah, so what I think the last statistics that I've seen, these are global statistics again. What they say is when you have an accident, it's a polytrauma. It's not just the arm that gets involved; it's also the head, the chest, the abdomen, or whatnot. If you have a polytrauma from either a motorcycle, commonly from motorcycle, because they don't have a lot of protection, and that's basically it. What they found is it's about 5% of them will have a brachial plexus injury. The degree of injury in adults is generally severe than in kids. So in other words, in kids there's a significant proportion of children that will spontaneously improve. Not that they don't need treatment, may not need surgery, but in adults it's the opposite. The forces that are transmitted when you fly over a handlebar and hit the ground at who knows what speed is so much more that they tear rather than stretch. So they almost always need surgery, versus kids that might improve spontaneously with a bit of care and therapy and things like that. And that's why we say refer them early, so we can assess them, we can reassess them and continue to follow up. And if we think that the child or adult is not doing so well, offer them that surgical option early rather than late.
And thank you, doctor. So what sort of treatment? I mean, you said in most cases it might be surgical. Could you advise?
Yes. So when they come to us, what we do is we classify them. So remember I said 5 nerves? All 5 nerves may not be damaged. It could be the first 2, which is cervical, spinal nerve number 5, 6. It could be 5, 6, 7, or it could be the whole thing. So when it's a partial injury, when it's a nerve, when it's just the first 2 nerves or the first 3 nerves that are involved, some of these might, especially in kids, some of these might improve spontaneously. They may not, but what we found is in kids especially, 80% of upper plexus, which is C5, 6 nerve injuries, improve spontaneously. They do need care. They do need, because if you don't move your shoulder, I mean any of us, if you don't move our shoulders or any joint, they are going to be stiff. So they do need occupational therapy or hand therapy. A therapist needs to be working on them all the time to make sure that the joints are supple. But they may not need surgery. The rest of them, some of the people with the upper plexus injury, when we follow up, some of them improve completely, some of them improve a certain amount, but then they plateau, some of them don't. The ones that plateau may need surgery down the line. But the ones that don't improve need surgery much earlier, sometimes in the first few months. It's the same with adults. But in the adults, as I said, the trauma that is, the forces that are used during the trauma is so much more. These are generally permanent injuries unless we intervene. So what we do is we assess them, we reassess them in a month's time, and then we plan our treatment. These surgeries are big. They're not small surgeries. They are generally, in the current situation in Sri Lanka, they're generally done by plastic surgeons. But anyone who knows how to do them can do it. These are multidisciplinary approach situations where it's not just the plastic surgeon, but the therapist, and then ideal and occupational therapist, because we need to integrate these patients back into society. The worst bit in this scenario is all these people are generally the young adults. They are not. I'm not saying anything about the 90-year-olds, but what I'm trying to say is there are people who are working for the family. They are probably the sole breadwinners in the family. And losing the function of a upper limb basically means that's it with regards to their career. So, I mean, it's really critical that these people come to us early. As far as what we plastic surgeons offer, we do a lot. Things have changed dramatically within the past 20 years. We do nerve transfers. So if it's a few nerves that are damaged, we can use other nerves in the vicinity that we can transfer to gain back function. We do grafts. We take nerves from the leg, cut it into pieces, and then bridge the gap if it's one of those. Even in patients that come late, this is not the best outcome for them, but even in patients that come late, we can take muscles with its own blood supply from the thigh and then transfer them to now do a different function. Now, obviously, these are big surgeries, probably not the best outcome. The best outcome is probably early referral, early surgery, and then early recovery. Because as you know, when the nerves get cut to the muscles, over time the muscles atrophy. And if you don't do them early, the muscles just don't work later.
So, doctor, overall, it's as you said a while ago on the program, they have to be referred immediately. But in the case of trauma, yes, I'm sure that will happen because they will be taken to hospital. There's no question about it. And this, of course, this can also happen to children who are engaged in sports.
Yep.
Injuries through sports, and the same type of injury can take place.
Yep.
Am I right?
Yep, definitely.
So that is also there. So all told, it has to be prompt attention. Now, doctor, you spoke about the younger people who are the motorcycle riders. Absolutely true. Well, we have even older people riding motorcycles. They're the more productive age, and they're, like you said, the breadwinners, and then it impacts in so many ways. Their jobs, their family, the economy, because they are working somewhere and they can't contribute to their workplace. Neither can, in turn, they cannot function the way they were functioning in their environment. Yep. So they put together. How does one kind of get the message across? This is important, coming from you, that they need to be careful. That is especially the motorcycle riders.
It's a very difficult thing to do.
Absolutely.
Because I think the only way they need to know the gravity of it. If they have a family member who has had it, they'll probably never ride a bicycle again or bike again, because the amount of the impact on that person is so bad that it's life-changing in most times. I mean, I wouldn't ever ride a motorbike, and I used to a while back, but never again after seeing these. The other way of it's very. I wish we could do a program on the impact that it has on the people, on the patients that has had this, so that the younger generation or whoever is taking risks see these. I think the only way to change the attitude is by education. They need to see to believe, and that's the only way.
I'd like to ask you a question, doctor. I need to ask you this right now. So when your patients are there and they're suffering through this all, they've been undergone surgery or they're awaiting surgery, anyway, they're in hospital care, and the situation is not at all something one can laugh about, no. So do they then regret? I just like to know, because we don't come in contact with the patients. You do. All the medical, personnel at all levels do. Your support staff, nurses, others, paramedics, all of them come in contact with them. So do they have any regret? Why did I regret that I rode so fast, I regret that I was not looking, or I regret overtaking whatever that caused the accident.
Yeah, I think they always do. Some put on a brave face, trying to say, look, okay, I'll do something else. But they always do, because the injury is so significant. Remember, although the common scenario is when you have a single side brachial plexus injury, you can have both sides brachial plexus injury on both sides, and that is life-changing, no matter how. So they always regret. I wish we had a support group. When we were when I was in Australia, we found that there were support groups for all these groups of people that have similar afflictions. I know we don't have one. We do have psychological counseling for them. We do have occupational therapy therapists who do a huge amount of work on these patients. I mean, a lot more than what we do, because they see them every week. We see them during the surgery, probably a few times after the surgery. So they try to integrate them back. They try to bring about function of the hand. I mean, simple things sometimes. It's not about riding a motorcycle again. It's about eating. It's about getting a spoon to your mouth. And it's about writing. Things like that. We're not talking about big milestones. We're talking about essential, simple things.
Interesting, and at the same time, I would say it's quite traumatic, not only for the patient, but also the family, all the loved ones around. It can be quite traumatic for them to cope with this. Because here was somebody hale and hearty, walking around and doing everything, and suddenly is laid up and is immobile or not that mobile. So, doctor, and this is a common situation that you come across.
Yeah, so I think one of the groups that I really want to address to is the young mothers who have had kids that are having this. If they are referred on time, if they are treated on time, vast majority of obstetric brachial plexus injury patients recover. But they need to be received and cared for early. So it's not the end of the world. I can't imagine the emotions that a young family goes through if their first child or the second or any child that is having palsied upper limb. So what you need to know is seek care. There are options, and those options are available in Sri Lanka. And that's a lot of people say, oh, these surgeries may not be there in Sri Lanka. No, we have plastic surgeons all over the country now, and almost, I would say, entire plastic surgical fraternity offers these surgery to these patients. And there are specialist clinics that happen. There are specialist therapists that are there out there who have got international training. What you need to know is, don't despair, come, we will guide you through the problem. And that's critical, because it's very easy to give up thinking that there are no options.
So, doctor, there is recovery at the end of it all to some degree, or will there be cases where one cannot still move one's arms?
The prognosis of this depends on how many nerves are involved. If it's just a few, they, following surgery, recover to be normal. Sometimes you can't even say that they've had a problem, except for a past history of or charts saying that they've done some surgery. When all the nerves are involved, the recovery rates are less, but then still better than not having operated on that patient. Far better than having not operated on that patient. There are patients who present to us late that have not recovered at all, and then it's a lot of work to get them back to normal.
Thank you, doctor. So, what's your take-home message?
Diagnose, figure out that there is a problem. That's the key. Come in early. There are options for treatment, and those options are available to you in this country.
Thank you so much, doctor. And on that note, we end this very interesting discussion on brachial plexus injury. And we thank you, Dr. Pravin Wijesinghe, consultant plastic surgeon, Teaching Hospital, Batticaloa, for sparing your very valuable time and sharing your expert knowledge with our listeners on the program Views on Health. Thank you so much, doctor. My thanks also go to Vimukti Eroshan for technical assistance. Thank you so much, Vimukti. And I'm Fatima Razikad saying good night and hoping to catch you next Monday, same time on Views on Health.